Good day, everyone. It's Steve Anderson from the Crown Council and the Total Patient Service Institute. Welcome to our webinar today. We're about 3 minutes from start time. I thought I'd just give you a few pointers. If this is the first time that you've joined us, you're on mute, which means that you should be able to hear us loud and clear, but you won't be able to hear each other. So that's to minimize background noise so that everybody can hear the presentation clearly today. That being said, this is an interactive experience. So as we go along, if you have any questions, you're welcome to enter those questions in the question box that is on your control panel. Make sure you find your question box. We'll use the question box for any questions. We'll go through the presentation and then we'll have some time for questions that we'll do after the formal presentation. A couple of quick announcements to get started. As you're all aware, the Crown Council annual event is upon us. Will be on January 29th, Friday. It will be an online experience, and we have an amazing day lined up for January 29th on Friday. So for information on that, if your office does not happen to be signed up yet, there is still some limited availability. We are sending out materials to teams that are participating. And so while supplies last of those materials, we welcome you to participate. So you can sign up and get information at ccannualevent.com. And we'll look forward to being with you for an amazing day on January 29th coming up. As well, coming up is the annual Smiles for Life campaign, which has become dentistry's largest charitable campaign. That campaign actually launches in the spring, and sign-ups to sign your office up, that happens right now, so that all the organization, the materials, the whitening kits can be sent out. For those of you that may be new to Smiles for Life, it is a charity campaign where your office offers to whiten teeth for a charitable contribution. There is some local involvement in your community where you can earmark part of the money that you raise to a local cause as well. And if you've never been involved in Smiles for Life or haven't signed up yet, we'd highly recommend it. It is a great new patient generator and does a tremendous amount of good. To sign up, you can go to smilesforlife.org/sign up, as is on the screen here, and sign up for that. So now's the time to sign up in preparation for the campaign that will launch March 1st all over the United States and Canada. So with that, we will get started with our webinar. Thanks for being here today. This has been a hugely popular topic last month and this month, as we have talked about insurance coding changes for this year. And today we'll give you the tools and things that you need to know to properly code and get reimbursed appropriately to maximize your reimbursement. Our topic expert today is Pam Peterson. Pam is the president of the Total Patient Service Institute. Pam has spent nearly her entire career in dentistry. Not only has worked in just about every position in the practice, except for the dentist and the hygienist, but everything else has worked across hundreds and hundreds and hundreds of practices. And through our Total Patient Service organization, interacts with practices every day. And so not only does she bring expertise to the table today, but also relevance because of the interaction she has every day with practices all over the country. So you'll get some tactical information today, what to do and what not to do, as well as some wisdom. And we define wisdom as knowledge rightly applied, and you are going to get some great application from her today as well. We're going to go through a lot of content today. We have created a resource page that you'll be able to download at the end of the webinar. We'll give you a link for that. that will help summarize some of the most important content and some of the most actionable content, including codes and how to use them, which is a big part of our discussion today. So with that, you're in for a great treat today. Get ready to take notes, because this is going to be a fire hose of information of things that you'll be able to immediately use to bill and code correctly and maximize your collections. So with that, Pam, welcome, and thanks for sharing your expertise today.
Happy to do it. Thank you, Steve. Happy New Year, you guys. Thank you so much for joining us. When I think about being the resource for you and representing our team, it's exactly what Greg Anderson posted the week after Christmas, which is, this is designed to make it easier for you. So before we get started, let's talk about where the change comes from regarding codes, because that's where we're going to start. All things codes. There is an organization, it's a committee called the Code Maintenance Committee, also known as CMC. Their responsibility is to update, change, reevaluate, and sometimes delete codes. Their sole purpose is to support you, the dental practice, the patients, and the insurance company. So we have an advocate for all three of us to make sure that we are all taken care of. This committee consists of 24 members, and they meet every year. So we really get excited when they present information so that we can update. And if you notice on the screen, there's just one letter between change and chance. And so by changing, it gives us a chance to operate at our optimal. So let's go ahead and go code shopping. So first, what's new in 2021? There were 28 codes added to the CDT and 4 deleted. We'll go ahead and start off with the 2 that were added right off the bat, which is the D0604. It's an antigen testing for coronavirus, also known as COVID-19. The D0605 is the antibody testing for COVID-19, also known as coronavirus. Now, when the code committee put these 2 codes in place, it wasn't because it had a massive amount of practices that decided they're going to immediately put this in place. They wanted to be proactive versus reactive. So in the event you decide this is what you want to do for your practice, it's available for you, and there are now 2 codes. Now, before you get too excited, there are some steps that you must take. The first step is to check with your state to make sure that you are authorized to do a testing in your practice. Every state is different. Second, if your state gives you the thumbs up and you decide this is something you're going to do, your practice must be certified. So it's not that you can just immediately put these codes in place and then off you go. There are 2 steps that you must take in the event that you want to move forward. Now, as we go through the codes, I want to tell you that this is applicable whether you are in network or not. These codes are how you code what you do. So whether you are have an agreement with insurance for assignment of benefits or you fee for service, this is applicable. And so the question that I have for you, and I know you can't answer me, is if I were to ask you if any of you have experienced a telehealth visit, 50% of you would say yes. And I'm a part of that 50%. I had an opportunity to have my first telehealth visit with my dermatologist. They're not going to do it ongoing, and it was the right thing to do at the right time, which was in March because the practice was shut down and they didn't want to cancel patients. So that was my first visit. Would you be inclined to know that teledentistry has been in place for some time, mainly cosmetic? Here are the 2 existing codes that have been in place even before COVID-19. D0391 is an interpretation of diagnostic. In layman's terms, it's an exam. The D996 is teledentistry, and the buzzword is asynchronous. And that means information that was stored and forwarded. And so that means it wasn't done at the same time. So one is the information sent to the doctor, and one is the exam. The code committee understood that it may not be now, but they wanted to be proactive, so they added a number of codes in 2021. Now, these codes are capture image only, and I'll explain that after I go through them. The first new code is D0701, panoramic X-ray, also known as PANO. The D0702, cephalometric, also known as Ceph. The D703 is an orofacial photographic image. The D0704 is a 3D photographic image. The D705 is a posterior X-ray. 706 is an occlusal radiograph. 707, periapical radiograph, also known as a PA. 708, a bite wing. And a 709 is a complete series, a full mouth series. Now, what's in bold, capture only, means the doctor is not present in the practice. And the hygienist was given instructions and an order by the doctor that he or she could take images and forward to them so that they can do a teledentistry visit. Now, I'm going to give an example, and before I give you this example, many states will allow a hygienist to perform a standard recare visit if a patient of record comes in routinely and it's just a routine hygiene visit. A hygienist can take care of a patient without a dentist being present. Now, there are some states that absolutely will not allow that. And so always check with your state to see what your regulations are. So the example would be if the doctor isn't present, he or she's not in the office, the hygienist completes the routine care and notices that there's a tooth that is in question. So with the order of the doctor, she decides she's going to take a photographic image, which I'll say 704. Also, she's going to take a PA, which is 707. That would be in the treatment plan. And because it's forwarded to the doctor, when he or she does the exam, they'll use those two codes that we just talked about that are existing codes, which is the D0391 for the exam and the D9996, which is to forward the information with that buzzword asynchronous, which means not done at the same time. Another question for you. I'm going to pretend that you can talk back to me. If I were to ask you, which of the following topics does your provider discuss with patients? Provider meaning your hygienist or your doctor. A, tobacco use. B, substance drug use. C, vaping, or any other things that could influence a patient to not do well as far as their dental needs. If you were to pick one of those, number one is vaping. The D1321 is a counseling for control or prevention of adverse or oral behavioral and systemic health effects associated with high-risk substance use. Now, many of the hygienists and the dentists, they talk about tobacco, and we just think nothing of it. They talk about drug use, nothing of it. Well, it really got the code committee's attention because of the high rise in vaping. Now, vaping is not the end all. It is one of many substances that could really, really be detrimental to your patients. Now, since your providers, which is the doctor and the hygienist, are having these conversations, now there is a code for it, which is the D1321. And as I go through this, I'm not sure who all on your team is attending. If your hygienists aren't attending and your doctors aren't attending, please thank them for counseling and taking care of the patients, the whole patient versus just teeth. And so this is the new code that was implemented, which is the D1321. Next, preventive. This code was added. This is a D1355. This is caries preventive medicament application per tooth. Now, this isn't an endorsement of the product. I'm using it as an example. Many practices will use silver diamine, whether it's for pedo, elderly patients with compromised health, where it's difficult for them to get to and from the dental office. So silver diamine will be used. If you're using any other caries preventive medicament per tooth other than silver diamine, this is the new code, which is 1355. The next, restorative, the D2928, this is a prefabricated porcelain ceramic crown. Because of the high rise in this procedure, and it's always miscoded, The code committee answered a request and it was approved. So now D2928 is for prefabricated porcelain ceramic crown, is now a code. Currently, the only code that exists is a stainless steel code. So you've guessed it, when practices were doing a prefabricated porcelain ceramic permanent tooth, they would use the stainless steel CDT code because that's all that was available. And then they would have to spend time writing a narrative. So no, you no longer have to do that. Next, let's talk about endodontics. Now, when you see this in red, the D3427 was deleted. This code was for root resorption and exploratory surgery. This one code took care of 6 procedures. And if you are a business team member and these are procedures that you do in your office, I know you're probably scratching your head thinking, no wonder I get massive amounts of denials after the second submission. Well, the code committee listened. This is no longer a catch-all code. This code was broken down to 6 procedures. The first one is D3471. It's a surgical repair of root resorption for the anterior. D3472 is a surgical repair for root resorption for premolar. 3473 is for molar. So if you notice, as the procedure was identified, they also made sure the area where the treatment was performed has been highlighted, which is the anterior, premolar, and molar. The next 3 codes for the D3427 being deleted is the D3501. This is a surgical exposure of root surface without apioectomy or repair to a root resorption. They did the same thing. They identified the area where the procedure was performed. Anterior for 3501, for 3502, premolar, and 3503, molar. As you notice, we're now in prosthodontis, where you'll see where there's 1 code deleted and 2 codes have been replaced. There's a trend. Any code that was a catch-all, the code committee really mulled over that to really break it down so that they can create the codes based on what was actually done. So it was no longer a catch-all code. Have they completed all of them? No, there's still more work to do. And I'm excited about how far they've come for 2021. PerioProtect had this code submitted on their behalf. When I shared with you earlier that the code committee's responsibility is to take care of you, the dental practice, the patient, and insurance companies, well, there was a patient who worked really closely with PerioProtect, submitted this on their behalf. And so the D5995 is a periodontal medicament carrier for the maxillary, which is the upper. The D5996 is a periodontal medicament carrier for the mandibular, which is a lower. Now, this is not an endorsement of PerioProtect. If you are using any type of laboratory processed trays for a medicament that's based on your standard of care used in perio or any other area of your practice as far as restorative, this is a code that's legitimate that can be used, which is the D5995 and the D5996 for the upper and lower. Next, for implant, this was another catch-all code. The D6052 was deleted and it was replaced with D6191, which is semi-precision abutment placement. This procedure is initial placement or replacement of a semi-precision abutment on the implant body. The 6192 is a semi-precision attachment. And if you look at the lower part of the screen, it's a replacement semi-precision attachment to a removable prosthesis. In the past, this 6052 was for both of these codes, and the only way insurance would even look at it, even before the second submission was denied, they would look at just the code and not the narrative. Although you did a really good job of writing a great narrative, now there's a good code that will identify what you actually did. Next, the D7960 was deleted and it was replaced with 2 codes. The D7961 buckle for the labial frenectomy and the D7962 is the lingual frenectomy. So they identified the area where the procedure was actually performed, as opposed to utilizing D7960 for buccal and lingual. Now it's broken into two parts, which is buccal for 7961 and the lingual 7962 if your practice performs a frenectomy. Coming in for a landing, these two codes, the 7993 for a landing regarding the codes, by the way, the D7993 is a surgical placement of craniofacial implant. The D7994 is a surgical placement zygomatic. And these are some pretty serious surgery. So if your doctor does extensive surgery for patients, these codes are really used for rehabilitation, for trauma or oral cancer. It helps patients get back to a more normal life. The zygomatic, which is the cheekbones, craniofacial, is nearly the entire face, putting someone back together. So these codes did not exist, and now they do. The D7993 for the craniofacial implant, and the 7994 for the zygomatic, which are identified as the cheekbones. Now let's talk about what's next. Steve shared with you that all of the codes, I know that you took copious notes on the codes, and I hope I didn't flood you with too many. All of the codes, you'll be able to download a summary at the end of today's webinar so that you'll have them right at your fingertips. Your action plan is to have a discussion at your next team meeting with your entire team. I would not just hoard this and make this just about business team members. It's everybody's responsibility to know what's going on, because you need their help, especially when you need certain films for certain submissions to insurance, whether you are in network or not. The next step is to go through your codes and remove the codes that were deleted so that you won't accidentally use them, and replace them with the updated codes for 2021. Let's talk about the next step, which is common coding habits that could get you in a lot of trouble, and it's by accident. And so we're going to talk about some of these common codes. Now, as I go through these codes, I want you to think about three things. One, yes, this is a great checklist and a checkup. We're doing really well. Number two, there's some room for improvement. Number three, we're going to do an overhaul and get things back on track. No matter where you land, there's always room to get back on the right track. So let's talk about it. So if you were to look at these three codes, and if I were to ask you which code is used after D4341, is it A, an 1110, B, 4355, or C, 4910? I know you guys are talking, I just can't hear you. So let's talk about it. If you chose 4910, you are absolutely correct. It's a perio maintenance code. If you chose D1110, which many have in the past when we've done a poll, it's not your fault. It's because insurance shared with you when you submitted a 4910, they went by their processes with insurance, not your standard of care, and downgraded your 4910 to an 1110. And some practices were like, okay, well, I guess it's D an 1110. Well, your standard of care is perio maintenance after perio. So D4910 is your standard of care. And what we recommend, it's never a good plan to alternate or downgrade to D1110. We recommend, and we are supported with Dr. Charles Blair, who is a resource partner with Crown Counsel and have been for a very long time. We recommend that in the notes section, you place in the claim, please pay the alternate benefits towards the 4910. This will allow you to still code what you're actually doing and not downgrading to a code that you really didn't do the procedure. Now, all insurance companies are different. Some will go, yes, I'll do it. Some you may have to push a little bit harder to get them to understand that D4910 is a procedure that you did, and please pay the allowable amount and place it in the claim section where it says notes. Let's talk about exams. Now, there are three exams that you're pretty familiar with. They're frequently used. The D0120, which is the problem focus, D0140 periodic exam, and the D0150 comprehensive exam. These are pretty common, so we use them quite a bit. 3 that aren't as common, which are D0160, the D0170, D0180, and let's talk about why. The practice advisors are in practices all over the country, and when I share with you that these aren't commonly used codes, it is the feedback that I get when they're working with practices, just like yours. So the D0160 is a complete exam or periodontal comp exam with extensive treatment plan, followed by a second evaluation appointment. An example would be if a patient came in and they had massive amount of decay, perio, it's a new patient, you're sitting down and you're talking to the patient about all of these things, and you're thinking, I don't want to overwhelm the patient, and I don't have enough time to go to the second step, which is to talk to them about their TMJ. So you would bring the patient back for a second evaluation appointment, and you may use the code D0160. And there are certain things that a clinician may need prior to the patient coming back, which is additional films, study models, also known as diagnostic casts. In the past, with this code, we would bring the patient back for a complimentary second evaluation, because we feel like we've already done the exam. So when we bring them back, can we charge them again? The D0160 is designed for a second evaluation for complex treatment plans. The D0170, this involves the re-evaluation of established patient for a specific problem when a definitive treatment has not been rendered. I know many times you'll have patients to come in and it's like a head scratcher, and you may need them to come back. And so sometimes we'll bring them back and we'll just call it a look-see appointment, and then come up with a created code that we have, like a house code. The D0170, this code is designed for a patient to return because definitive treatment has not been rendered. And this can be used for soft tissue or teeth. It's not just limited to ulcers or leukoplakia tissues or any type of abnormalities that you see on the tissue. It's for teeth as well. The D0180, this is a comprehensive periodontal evaluation code, and this may be reported for new and established periodontal patients with signs or symptoms of risk factors related to periodontal disease. Now, risk factors meaning, are they a smoker? Do they use tobacco? Do they have any high inflammatory diseases such as diabetes, high cholesterol, hypertension? All of those are considered risk factors. Now, when using the D0180, it cannot be used alongside a D150. This is a standalone code for patients like I just described, which is for a comprehensive periodontal evaluation. Now, with this code, there are regulations that must be followed when using this code. There must be a 6-point measurement around every tooth, recording of bone loss, gingival attachment, furcation, recession, mobility, and of course periodontal diagnosis with current FMX. And when you say current FMX, I mean current FMX, which means if they are outdated, they must be current and legible so that you can see the signs of bone loss that's reported in the narrative when you submit to insurance companies. Let's talk about the most underutilized codes and how to use them correctly. These are sneaky, they're quiet codes, and we often see that they're not coded. The D0220 is a PA. The D0230 is a PA as well. The difference between them is the 0220 is the primary, it's the first, and when you need an additional film, you use D0230. Many practices will use D220, and the second submission will get denied because of frequency. When you use the 0230, it is designed for an additional PA. Buildups. The D2950 is frequently used, and the D2949 isn't used as often. Now, I know that there are a lot of payers that consider buildups to be inclusive of the crown, but we want to talk about the difference between these two codes. The 2950, if you were to read and the description of a 2950, it's for retention. And I know you're thinking, well, we are thinking, well, all buildups for retention? Well, the insurance payer feels that the retention is in the prep. And so if you have 50% of the tooth that's missing, lingual cusp is missing, you have to build the tooth up so that you can prep it for retention. That's the description for the D2950. The D2949 is really a filler to fill in. It's considered a buildup as well, and how you would use a 2949 if it's a tooth that's treated with endo and you're filling it the occlusal because the occlusal was open for access, you would use the D2949. Now, is this 100% that you're going to get the insurance company reimburse 100%? Maybe not. And this is a better chance to go this route than not, because there is a difference between the two codes. Let's talk about claims. Whenever I talk about insurance claims, I always think about Tanya Bailey, who was a practice advisor that I've worked with TOPS for over 10 years. She got really frustrated when this claim came out because she said it was quiet. The new updated claim is, if you look at the bottom where the arrow, it states 2019, it's American Dental Association. So when this claim came out, it was pretty quiet. They didn't make an announcement. All we saw was a bunch of claims being rejected because they were using the wrong claim. So we really pay attention to when it's time to update your claim form so that you won't get a lot of claim denial. So she wish it would have been entered with bells and whistles, but that's not the case. Now, I know that everybody's digital and it's rare that there is a paper claim. You could easily look in your software, print it to ensure that you have at the very bottom 2019 American Dental Association and that you're using the correct claim. There's a couple of areas that I want to talk to you about on the claim as well. The box number 33, you want to make sure that you place an X on missing teeth or missing tooth. And number 35, the remarks, that's where your notes will go. Now with the insurance reps, a lot of them are plug and play. They're just following their system. They look for boxes. Then you'll have some that'll look for boxes and actually read what you are doing. Make it easy for them, whether they are just plug and play or if they're reading your information. Place the information in the correct box to ensure that you have a clean claim when it's submitted. The next arrow, which is the box 36 and box 37, no matter what software you have, you're able to do this in the section of your software where you can have signature on file. When you have signature on file and you are doing electronic claims, this information will come up on your claims, but you want to make sure that it's attached and it does not, you don't submit with it being blank, because you want to make sure that you have your patient's permission, and you also want to make sure that you have permission to have the check payable directly to your practice. And I'm sure that's a resounding yes from all of you that's attending today. The next two boxes I would like you to pay attention to is box number 53 and box number 54. I'll start with box number 53. If you have a lead doctor that is the owner of the practice and associates that are working with the owner of the doctor, meaning a dentist, you want to make sure that the treating dentist information goes here, not the owner of the practice, unless the owner of the practice treated the patient. It must be the treating dentist. If it's not the treating dentist and it's the owner of the practice and he or she did not treat the patient, that's considered fraud. And I know that that's an ugly word, but that's the truth. It's considered insurance fraud. So you want to make sure that you place the treating dentist in that area, box number 53. Box number 54 supports box number 53. NPI is a national provider identification number. It helps the insurance company identify who the provider is. Every provider should have an MPI number, and they're pretty easy to obtain. If you have questions, you could easily just put it in the chat box and we'll answer how to get that. Now let's talk about Ohio. Only handle it once. And so we are an acronym company, and this is one of our favorite acronyms. When we think about Ohio, only handle it once, we know what you do day in and day out. And when you're able to get the technical things done, where you only handle it once, where you take time to do it right, it affords you to do the things that you enjoy, which is patient interaction and not being a paper pusher. So let's talk about some things where you only handle it once, so it will afford you to have fun in your practice. First, this is the checkup. When I talk to you about where you're nodding your head like, yes, we got this, we're doing really well, or there's room to improve in this area, or we need an overhaul, make sure that you identify where you are, and there's always a reset button. The first, you want to make sure that the insurance claim is filled out completely. Don't take shortcuts. Shortcuts are depressing, which means you're going to have a stack of claims that you have to find time to go through because you took a shortcut. Make sure that the claim is filled out completely. Number 2, the correct procedures are listed on the claim. Number 3, the claim is filed, submit it within 24 hours. Only handle it once. You have better and greater things to do, so go ahead and get it done. Number 4, correct documentation is sent with the claim. When I talked about the D180, which is a periodontal exam code, your hygienists are doing a really good job already with 6-point measurements. They are tracking and making sure that they record bone loss, gingival attachment furcation, recession, mobility. Make sure you thank them today, because that's exactly what you need so that you can submit the claim with the correct documentation. That's why this is a team effort, because what they do in the clinical area supports you in the business area. Last but not least, you want to review the claim submission status. And I'll tell you what that means right after this one. There are 3 reports that we recommend that you check daily. Now, we've had some practices that say we check this weekly. If you want to practice Ohio, only handle it once, daily is the way to go, because it's easier to take care of 2 claims versus 20 claims. Number 1, and it doesn't matter what software you have, the verbiage and the language may be slightly different, and these reports are available no matter what software you have in your practice. The first one, check insurance claims not sent. Number 2, procedures not attached to insurance. Number 3, secondary insurance claims not sent. Now, number 3, whether you take secondary insurance or not, we recommend you check the secondary insurance claims not sent. You would be amazed if we share it with you how many practices we see where somehow it shows up on the secondary insurance claims not sent, and the practice do not submit secondary insurance. So you want to make sure that all 3 of these reports are clean and blank by the end of your day, so that when you come back tomorrow, you can start with the next day as opposed to working backwards and taking care of what could have been taken care of. Next, when I said I'll share with you what this means as far as check your claim status, this is what I meant. You don't want to be the woman that's standing on a rock looking, wondering, where's my claim, thinking that there is an elf somewhere shredding your claims as they come. That's not true. The first report is a validation report. A validation report is exactly what it sounds like. It validates that your claim was completed. Now, the validation report will actually give you a couple of warnings before it's rejected. It'll first give you a warning that something was missed, and it's automated, and so it's just checking boxes. If you don't correct what the warning is, then your claim will be rejected, which means it's not going to go any further. So if you check your validation report and it's clean, the next report is a confirmation report. It confirms, yes, you guessed it, that your claim is valid. You want to get to the last report, which is a clearinghouse. The clearinghouse means, for the best of their ability, your claim is clear clean, and it has all the necessary information. So off to the insurance company it goes. Let's talk about the summary. So the first thing is meet with your team all through your practice, the things that you are responsible for, whether it's in the business area or the clinical area. What are some things that you can really practice Ohio, but only handling it once? Number 2, you want to make sure that you submit your claims within 24 hours so that you can start fresh the next day. Number 3, check your claim submission status. And number 4, this is a bonus. What I love about number 4 is we are together, we are better. And I know you've heard that many of times, and I'm going to keep saying it. You want to make sure that you train a co-pilot. Look at the person to your right and left, and it doesn't mean that you're going to give them things that you're responsible for. You want to let them know what you're working on. So in the event that you need support, the person to your right or your left can support you. If you have 2 business team members or 3 business team members or an additional assistant that can lend a hand, sometimes we need help. And in the event that someone's available, train a co-pilot and give them the responsibility to help you with keeping everything on track, so that in the event that you're out on vacation, the practice will continue to trend upwards as opposed to downwards. All right, Steve?
Excellent. Thank you, Pam.
My pleasure.
All right, we have a couple of questions. Are you ready?
I am.
Good deal. Before I get to the questions, one, as you'll see on the screen, this is a common question that we get, especially when we get into coding and what do I charge for what procedures. So with this webinar today, there is a complimentary fee analysis consult with a TOPS practice advisor that will give you expert advice on your fees based on your exact geography. So it's great insight to have to make sure that your your fees and your coding is optimized. So to sign up for that, you can go to the link on this slide. This is a mini website link. So in your browser, whether you use Safari, Explorer, Google Chrome, whatever it is, just go to this website, bit.ly, it's all lowercase, / send me the link, all one word. And there's some simple information there that's requested, including the zip code for which you would like the analysis done, and then a good time to schedule the expert advice and the expert insight on your fees, your geography. So that's something that we highly recommend that you do at least once a year. Beginning of the year is a good time to do that. So that's an easy way to do it. Again, it's a complimentary fee analysis with an expert opinion to go along with it to give you some insights into your market. In addition, the summary sheet that I mentioned at the beginning of the webinar, if you'd like a summary of the things Pam's talked about, that's available on the Crown Council website. So just go to crowncouncil.org /webinar, and it'll be the first webinar listed, and it will have the resource sheet there that you can download. Okay, with questions, Pam, let's start with.
You have to read them. I can't see them.
What's that?
I said, thank you for reading them. Can't see them.
Got it. Okay. We're going to refer to, and this is from Laurie, this is code 1352 versus 1354 versus 1355. All right. So the question is, what's the difference between those first two codes and the new 1355 code? So let me restate. What's the difference between 1352 and 54 versus the new 1355, which is silver diamine?
The key word is carries preventive. And so if those two codes don't have those key words in it, then you may run the risk of your claim being denied.
Got it. Perfect. I'll highlight a couple of things to wrap up on these. All this, a lot of detail here, obviously, and you can get the resource, kind of the summary resource sheet at crowncouncil.org/webinar. One of the things that you mentioned, Pam, is in terms of credentialing and making sure that whoever did the work is the one who bills the work. In other words, whoever was the doctor provider needs to be the one that for whom the insurance is filed. So we run across that a lot, interestingly enough, in two doctor practices that it's not done correctly, and it can be considered insurance fraud.
Yes.
So billing it correctly, coding it correctly are all key aspects. If you have and when you have additional questions, Pam, I think we can go to the next slide, perhaps. Okay. For any questions that you have moving forward, you can go to the Total Patient Service website, totalpatientservice.com. There's a live chat function there where our team can help point you in the right direction, or give us a call at the Total Patient Service Institute, and you can see that phone number on the website. So upcoming dates there for your information. Most of you are very familiar with the resources that are available through the Total Patient Service Institute, which Pam leads. The upcoming Leadership Academy next Friday, a week from tomorrow. Total immersion, which we consider required for every member of the team because it is all about team patient service and case acceptance, which is coming up in 2 weeks on Friday, January 22nd, and the No More Hygiene course on February 12th. So again, all that is at totalpatientservice.com. Pam, thanks for your expertise today, and we hope that the information that's been provided today will help you have a more successful 2021 as you code correctly and get paid for what you are doing. So thanks so much, and thanks again for being with us today. Pam, thanks for all your wisdom.
My pleasure.
Thanks, everybody. Have a great day.